that time, I was a recent graduate of Morehouse College. 2 weeks after getting my degree, they said, you need to go on dialysis. Had no warning. My creatinine level, which is a measurement of how your kidneys function, was at 6. The normal range should be below 1.7. So I was a 21-year-old, not knowing where I was going in life, and now I had to dealing with an illness. So it was quite difficult, but I overcame. I am an 11-year transplant. I got a transplant 11 years ago, so I'm a survivor. My donor was my sister. We were luckily the same blood type, which is A positive. And we got transplanted at Piedmont Hospital, and there are 2 major transplant facilities in the Georgia area, which are Piedmont Hospital and Emory. My presentation is going to give you a little bit about the reality of kidney disease. And the name of my foundation I founded 11 years ago is Renality Foundation. It has renal in there for kidneys, and it is the reality of renal failure. Our long-term goal is to have a cure for kidney disease. Currently, there's not a cure for kidney disease. You have to have replacement treatment options right now. But I will talk later in the presentation about some of the great advancements in medicine. All right, so this is our goals real quick are improving lives, impacting programs, integrating ideas, and involving the community like we have here at Operation Mobilization. Real quick, our mission is to enlighten and bring about kidney disease awareness and be an advocate for sustaining and improving lives in the immediate and broader communities. We do this through researching, educating, notifying, acting on ideas, leading people to healthier lifestyles like Monique was talking about earlier, investigating, talking, and yoking up with organizations like yourself. And these are some of our great board members that we have in Atlanta that helped us to found the foundation. We have several doctors, all the way from anesthesiologists to ER doctors. So when a patient calls our foundation, they can speak to them directly. These are my great physicians that kind of saved my life, including my sister, of course. This is my nephrologist. Nephrologist is just a kidney doctor. And then the next thing is Dr. John Welcho. He's one of the most renowned surgeons in Atlanta. He's been doing it, he did it over 35 years when we really didn't know how to do the immunosuppressive medications, and we were just learning about that. But he just retired last year. So let me talk about how I developed kidney disease. Really quick, if we look here, we see the ureter, and then we have the kidney. In my situation, I didn't have my kidney, it wasn't from a bad lifestyle. Mine was a very rare cause, and the cause of mine was my ureter was blocked, and it kind of had the shape of an hourglass, so it's coming down like this. So as the waste was to be filtered, it would stop in the middle and come back up, and it caused obstruction to my kidneys. This is the reality of kidney disease. So once I was told that I would have to get on dialysis, this is my arm. This is the only way that I was able to stay alive was through hemodialysis. Hemo being hemoglobin, which is through blood being filtered through a machine. So what would happen is, why is this vein so big? The vein is so big because if you were to be stuck by a needle every day, your veins would not be strong enough. Therefore, they had to tie what you call an arterial vein and a venous vein together to make a big enough vein for the needles to fit through. So here you have one needle would be implanted this way. Another needle will be implanted this way. The tubes will go into a machine, filter the blood, and come back in through the second catheter. Why kidney donation is critical? Donor kidneys are in very short supply, as we know. 600,000 Americans have end-stage renal disease. 50% of dialysis patients are alive 3 years after they start therapy. But if you get a donation like myself, I'm 11 years with a donation, with a kidney transplant, 91% survival. So this is critical. The cost of dialysis is tremendous in America, $40 billion. So as the director was talking about, Doris was talking about, you see clinics opening up everywhere. That's it, $40 billion. So it's a very lucrative business, but lives are at stake. So I was born with one kidney, and as a result of having one kidney, it was infected. So the doctor said, Justin, if you want to get a transplant, we know you do not want to do this, but you have to take out your remaining kidney and live with no kidneys. So if you live with no kidneys, what? You don't urinate. So I didn't urinate for 2 years straight. And so I'm going to talk about laparoscopic nephrectomy. A laparoscopic nephrectomy is just where they use robotics to squeeze out a kidney. So if any of you guys are considering being donors, you will not be cut open. Okay, they will make 2 small incisions and they will just squeeze it out through a computerized machine. So it's not as invasive as it used to be. So they're going to take 3 or 4 small cuts, usually no more than 1 inch. Okay, and the surgeon will cut the ureter, place it in a bag around the kidney, and pull it through the larger cup. Okay. Recovery time is very simple. Now for the donor, the person that donates, it may take you a little longer to recover. Why does the recipient recover faster than the donor? That's because the recipient has been down so long. When he gets that kidney, he's jumping like, yeah, you know, I'm urinating, my urine is, you know, it's the right color. Whereas the donor, you may be perfectly healthy, you're not used to it. So it's going to be 2 to 7 days into the hospital. You have to sit on the side. You'll be asked to sit on the side of the bed and walk on the same day of the surgery. So they want to get you up quick. As soon as you have a surgery, transplant, they want to get you up within 24, 48 hours because they don't want you to become stagnant. So here we see a picture of my laparoscopic nephrectomy. This was done prior to my transplant. So as you see, the incisions are probably hard for you to see. They probably look like my freckles and everything else, so you can't really see. So these are immunosuppressants that are required once you get a transplant. You will be required to be on at least 2 immunosuppressants. What happens is we want to stop organ rejection. So since your body knows that the transplanted kidney is a foreign object, you must suppress your immune system. So 2 of my drugs are, this is Prograf, and the other one is mycophenolate. And so these are the drugs. These drugs cost about, I would say on average, $1,300 per immunosuppressant. So it's close to $2,500, the average cost. I don't pay that, but I have insurance, and that is a month. Yes, it is. Very expensive. Now, the prednisone, of course, is a steroid. And the steroid is just given to you to keep the mass of the kidney, so the kidney doesn't lose its mass. Next. And this is just a scar from my... That's just a scar from my transplant surgery. And as she was stating, you know, your kidneys are in your back below your ribs. When you get transplanted, they put it in your stomach. So I guess it makes it a lot easier. You're not near the rib cage. I mean, near your backbone, so to cut down on that. Okay, this is a documentary that I produced 2 years ago. And this documentary has patients that are no longer with us, but I recorded it over a 7-year period. I'll show you maybe 3 minutes of it. And this will kind of let you see the face of kidney disease.
South Atlanta area, South Fulton, southern region.
dialysis for 12 years. I've been a patient activist for the 12 years that I have been on dialysis.
I found out about diabetes in 1989.
I was singing little ball bouncing on the ceiling.
I found out about kidney failure when I was in the hospital. I ended up getting sick, ended up in a hospital, not knowing what was going on with me, feet swelling up, can't breathe, heart palpitations, all types of things, fluid on. That's how I found out. And one day it just happened.
And one day I just started going to the bathroom a lot, urinating a lot, and I was eating a lot.
I'd give out walking. I couldn't walk very far from here to the house. I used to be.
I believe it was about a month later, I went to the doctor and he told me I had diabetes.
I had to check it out. And I had some blocked arteries coming out of my heart, going to my lungs. They said that's what I have bypass.
My kidney problems started as a child, which I wasn't aware of at the time. But I always had kidney infections and things of that nature growing up. At that time, being a child, they didn't discuss the problems with me. I just knew that I always had to go to the doctor because I had kidney infection.
But you just a normal job, and it's not life and death. It's not a similar thing where you just do your thing and go home.
Early detection can help prevent the progression of kidney disease.
Okay, so as you saw, those are a few of the patients. If you saw the older gentleman that was talking about the heart bypass surgery, he was the longest living on dialysis that we know of in Georgia. He started dialysis when there was, they call it a washing tub, and it was just so big in the 70s, and you had to actually get on a list just to do dialysis, just like a transplantation. So not many people were surviving in the 70s. However, Donald had been on dialysis for 35 years, and he died a week after that recording. So he's a strong man, was. This is a campaign that we started called Yes Urine Campaign. Really quick, the Renality Foundation, we did a short information video about the telltale signs of your urine.
Let's talk about urine.
Urine?
Yes, urine. Believe it or not, the color of your urine offers many telltale signs about your lifestyle. It can reveal what you've eaten, how much you've had to drink, and even what medications you're taking. For example, pink to red urine could indicate blood in the urine. Foamy urine is a potentially serious symptom because it may indicate high amounts of protein in the urine. Other examples of abnormal urine colors and consistencies include orange, blue or green, and tea-colored. There is one simple but important step that you can take in helping to prevent kidney disease. Drink plenty of fluids, especially water, unless you have been diagnosed with certain illnesses like end-stage renal disease. You can also contribute to a healthy lifestyle with regular exercise, a healthy diet, and reducing or eliminating alcohol consumption. Consult your healthcare provider before beginning any fitness programs or changing your diet. This message brought to you by the Renality Foundation, which you can find and like on Facebook. And visit and join the Yes Urine campaign at yesurine.com. Here you can buy merchandise or donate to support the cause of kidney disease awareness. Are you with us? Yes, urine.
Are you in?
Are you in? Are you in?
Yes.
Yes. Yes. You're in? Yes, you're in.
Yes, you're in.
Yeah, it's kind of cheesy, but it was last minute. You know, late at night, I was just thought of that. All right, so we talked about, one thing I want to go back to. Now, my grandmother is old school, so she found out that I had kidney disease. Boy, tell that boy to drink plenty of water. You're not drinking enough water. No, if you have end-stage renal disease, you may not want to drink a lot of water because it's like a carburetor. I don't know if you know about old cars and you can flood the carburetor. So if your kidneys aren't working, you don't want to get more water. So that could be a problem. So real quick, and I'll be finished, the importance of our organization. Almost every American knows someone with diabetes. I was talking to Ray earlier, and Ray was telling me about his situation, and I told him, well, you can go anywhere. If you tell someone, hey, diabetes, high blood pressure, they know someone or they have it. So it's very prevalent. African Americans, minorities, are 3 times more likely to develop the disease. 15 people a day die waiting on it for organ transplant. We have the power to make changes, and we want to increase organ donation. This is real quick. Nanotechnology is the newest technology that they're using now to create organs. So what they're doing, the main 2 places are Vanderbilt and the University of California. We have 2 professors on our foundations from Emory that are doing nanotechnology at Emory University. So this is just a technology that utilizes a membrane system, and then this technology is used to mimic the function of the organ. All right, so using silicone nanotechnology, similar to a computer microprocessor, they create a bio-artificial kidney that marries with nanofilters made of silicone. So when we talk about nanofilters, just in relationship to a soccer ball, if you can imagine a soccer ball, it would take about 15 million nanos to create one soccer ball. Okay, diabetes is the leading cause, and some signs that you might be diabetic would be protein in the urine, high blood pressure, your legs swelling, leg cramps, increased need to urinate, abnormal blood test, less need for insulin, and also morning sickness. So these are the ABCs for diabetes. You want to make sure that A is for the A1C test, and it's short for hemoglobin A1C, and it measures your average blood glucose. B is for blood pressure. We want to make sure blood pressure is 130/80. And then the next one is C is for cholesterol. Okay, kidney replacement treatment. So when you come down with kidney disease, there's 2 ways you can dialyze. Hemo, meaning through the blood, as I showed you earlier, where you have a machine and you're stuck with a needle. These needles usually range from 15 gauge to 17 gauge. So, real funny story, when I went to Dallas, you said, what gauge needle do you use? So I said, give me the lowest one. I said, 15. Like, no, that's the biggest one. So the lower the number, it's the first time, it was really pretty painful. So, okay, peritoneal dialysis is just where they insert a catheter in your peritoneal cavity, and your blood is cleaned inside of your blood. The doctor does have to do a surgery to implant that plastic tube. Now, I want to back up with hemo. You cannot use this access on your arm right after the surgery. So you have to be, a tube is placed in your neck, and you will have that in your neck for about 2 months. And so that's where you're dialyzed, through your neck, until this vein gets big enough to dialyze. Kidney disease in minorities, we know that minorities are affected 20 times as likely as whites. 30% of patients on dialysis are black. Minorities have lower rates of organ donations just due to a lot of fallacies. African Americans wait twice as long as any other Americans for kidney transplants, and 50% of those awaiting kidney transplants are African American. Okay. Who wants to play a little bit of Jeopardy? Woo! All right. I'm gonna, the transplanted kidney is usually not implanted in the stomach region. Is that true or false? False. Let's see if that's right. Well, it has a little music that I want them to hear. You just go false. Oh, yeah, right? That was right. True. I mean, it's false, but you were right. All right, let me go to the next one. All right, a kidney taken out laparoscopically will leave at least a 12-inch go back. No, you're fine. A kidney taken out laparoscopically will leave at least a 12-inch scar on the donor. Oh, you guys. I think you guys are the first ones that actually listen to me. There are more than 26 million Americans living with chronic kidney disease. True. Did I say true? Three for three or four for four? If your organ donor is your twin, then you don't have to take anti-rejection transplant medications. That is true. That is true. In May of 1953, we had the first organ donation, which was between two brothers. Robert was a donor to his brother who had gotten out of the Army. And if your twin donates to you, you guys have the same makeup and everything. So you don't take any medications. That's the only cure.
Maybe it's identical. Would it have to be an identical twin, not fraternal twin?
Yeah, it'll have to be identical. Right, exactly.
But you didn't tell us that before.
I did, oh, you're right. We won't count that one, I promise. The average cost.
If you're going to cheat, we're not playing.
The average cost per patient for transplant anti-rejection drugs are about $2,000 a month or more.
Oh, because it was more. It was 2,500, wasn't it?
Yeah, I didn't put more on it. I apologize. True. About. That was an error in the game.
Well, you're really messing us around now, yeah.
We're almost finished. Okay, okay, that's the last one. You guys did great. Steps to prolong kidney function. Delay the onset of dialysis. Eat right and lose excess weight. Exercise regularly. Don't smoke. Avoid salt in your diet. Control high blood pressure. Control diabetes. Stay on your job. It's very expensive. Keep your health insurance. Talk with your healthcare team. Watch your phosphorus levels and reduce your proteins. And I want to add one more on there. We were talking about Doris and I. Processed sugars also. You want to be very careful.
How do you get the phosphorus in one?
Phosphorus would be like cheese and dairy products. Yeah, and what we do is when my phosphorus levels were very high, they would give me what you call a calcium binder. They would give you Oscal. And Oscal somehow brings down your phosphorus levels. It binds with the phosphorus. All right. That's it, everyone. Thank you so much. I appreciate it.